News Channel 8 presents New Skills for Living with your host, Tom Lavin, a healthy plan for healthy living.
Hello and welcome to New Skills for Living, a show dedicated to healing and wholeness in our community. Today we're going to continue our series on addiction recovery, and so if you're interested on this topic of recovery from alcoholism and drug abuse and other addictions, you'll want to watch our show today. We have an excellent expert guest with us today, Mick Hall. Mick is a licensed clinical alcohol and drug counselor, and he's also a licensed marriage and family therapist. He's been in the field for many years. He's helped a lot of people. He's the clinical director at Bristol-Cone Family Resources, and he also has a private practice called Life Matters, where he works with couples and families and adolescents. And so, Mick, thank you so much for being on the show.
Pleasure,
it's great
Tom.
to have you here.
Thanks, man.
So, Mick, I think the first thing, I'd like to just jump right in with this idea of recovery, Mick, and ask you, what are the most important 5 things that people can do to enhance their recovery from alcoholism and drug abuse?
Yeah. Okay, first thing, man, don't use. No matter what, don't use. The whole idea of abstinence is not, although not an absolute, it is certainly necessary for progress. And we know that this is a brain disease and that people have a tendency towards relapse, but the longer that people don't use, the greater the likelihood that they're going to have sustained so-called recovery, okay?
Mm-hmm.
So the injury takes a long time sometimes to heal. It isn't just a flash in the pan. It's not just a 30-day treatment or anything like that. Secondly, take advantage of the services offered at the treatment facility that you may frequent. They probably have a rich array of aftercare services, okay? Thirdly, I would say a recovery support system, critical. This does not work in a vacuum. This doesn't work in isolation. One of the things we talk about frequently in treatment is the whole notion of denial and isolation and stuff like that. Be honest with you, Tom, I don't see nearly as much denial as people would think. Denial to me falls on a continuum, and some things people don't want to talk about, but almost none of our clients, by the time people get into treatment, it's not about denial, it's about the shame associated with the behavior of use and the continued use, despite the fact that they want to do something different, and that's tough. Next, I would say, situate a living environment that's supportive of your recovery. Get your family involved big time. Get your family involved. Get your kids involved. Recruit people. If you had cancer, who would know? If you're in recovery, who do you want to know so that they can't? You got to be upfront about it. You can't go underground on it. Dealing with the shame and guilt associated with this thing that to me is the biggest hurdle for people getting into recovery. Last, I really, in the years that I've been doing this, and the wonderful experience I've had doing this, people have taught me that everybody is unique, and everybody's recovery is unique. I don't subscribe to what works for one person works for another. So situating a recovery environment that's unique to you, I think, is absolutely critical. And possess that. Make it yours. Be proud of that, because you are an expert on you far more than, no matter how much time we might spend in therapy together, you're going to know you better than I know you.
Yeah. So we need to know ourselves and know what our needs are. And then,
Huge.
Mick, I've also heard you talk about it's important that people know what their strengths are and come from there. Can you tell us about that?
Absolutely. I come from a perspective that people have a tendency to get to drown in the shame and guilt of the whole notion of recovery. I don't subscribe that people focus overly attentively on the things that they don't do well. I'm talking about if somebody has a job, if they have a supportive family, if they are inclined to be gregarious socially, utilize these to your advantage. One of the things that, is really critical, Tom, is people relapse.
Mm-hmm.
People relapse with cancer.
Mm-hmm.
People relapse with cavities. People relapse with diabetes. Relapse, this is a disease. This is a brain disease that's characterized by relapse. The one thing I really want to point out is just because people may have a relapse doesn't mean that treatment doesn't work.
Yes.
And I'm so big on that because when somebody's able to put time together, it matters.
Yeah.
It really matters.
You know, Mick, you're just entering a really important topic, and we want to do that justice. So right after this brief break, we're going to continue to talk with Mick Hall about that topic. Hello, and welcome back to New Skills for Living. You'll see up on your screen some information about the website where you can watch Mick's interview and the whole addiction recovery series at www.easeap.com. Again, you'll be able to see Mick's interview and the other interviews on streaming video that we get from KOLO TV on that website. So please go to that website to watch Mick's interview. And then next I'd like to show you and remind you, those of you that regularly watch the show, that there are over 80 newsletters available on the website that you can scroll up and you can read, or you can make copies, or you can send them to families and friends. And it's on addiction recovery, it's on depression, anxiety, stress, communication, loving relationships, over 80 topics. So please feel free to go to the website and check this out. So now we want to transition back to Mick. And Mick, I think a really important question that I have, and maybe our audience does too, is how does somebody know if they have a problem with alcohol and drugs and maybe they need help by getting into treatment?
Yeah. Problem is the key word, Tom. We don't do behavior problematically and continue it. Typically, if there's a problem, we're going to cease. Have you ever had somebody doing something and they decided to cease this behavior because it was good for them? Typically, if you're going to cut down, or if you're going to make an attempt at cutting down, you're already internally motivated to ask yourself, do I have a problem? It's a real typical thing for people to try to prove to themselves they can not drink during the week and just drink on the weekend or something like that. So cutting down or an attempt to cut down is one of the major areas determining if somebody has a problem. Have you ever been annoyed by somebody complaining about your usage? Family members, could be your boss, you could have lost a job, something like that. Annoyance, big time. You ever felt guilty about what you do? If somebody's addicted, they have a tendency to go into themselves and so forth. We don't like to talk outright about this. So if I'm guilt-ridden, I have a tendency to keep to myself a lot, and it can be pretty debilitating unto itself. Lastly, you ever use in the morning, especially with alcohol? We call it an eye-opener. So we have this CAGE, CAGE definition of dependency. So,
okay, so that's a great little group of questions that people can ask themselves, Mick, that you just went through, like, do I have a problem or not? And maybe I should seek help. If someone answered, 2 of those or 3 of those positively, they might want to...
When in downtown, I try to keep things real simple. If there's a problem, or if somebody says I got a problem, I probably have a problem.
And then, so what would somebody do if they're watching the show and they go, wow, I guess I do have a problem? What would they call bristlecone?
They can. They can. I mean, there are a lot of resources. Understand that treatment has a number of layers, and first of all, we want to make sure that all treatment is tailored to fit the needs of the person. I hate trying to sell a car to somebody that doesn't need one, okay? And I'm not into sales. I am about treatment. We start with an assessment. We set up an appointment with you, and we ask clearing, screening questions to figure out the severity. You may not need residential. You may not need any treatment at all. You know? But typically, by the time somebody gives us a call, there's something going on.
So, in knowing you, Mick, and people on your staff, so if someone called bristlecone and said, I think I've got a problem, can I come talk to you? We've got about a minute here,
Okay.
Mick. They're gonna meet someone that's kind and compassionate, not somebody that's judgmental or wants to put you in a box. We've got about a half minute.
No, it isn't about containment, and we do not keep people against their will in any way, shape, or form. Yeah. I'm just so proud of the staff and what they do.
And it's about your staff people really being compassionate and trying to help someone who's reaching out and asking for help.
We believe this to be a brain disease. Yeah.
So again, if you were answering some of those questions that positively, where you've said, yeah, that seems to be a problem that I have, that those questions Mick was asking. Bristlecone is one of those places you could call, or Alcoholics Anonymous, to go get some help for yourself. We'll talk more about treatment and recovery right after this brief break. Hello and welcome back to New Skills for Living. We're talking with Mick Hall, the Clinical Director at Bristlecone Family Resources. Mick, how extensive is this problem of alcoholism and drug abuse in our culture and then also in the Reno-Sparks, Northern Nevada area?
We figure at large about 10% of America, if you exclude nicotine, which is the most addictive substance we've ever found, about 10% of America could be characterized as problematic in use of substances. Of that, only about 10% of that 10% receive the treatment that they need. Here in Reno, U.S. News and World Report cited us as the booziest city in America. I don't know, there's a rather distinction there that I'm not sure we're proud of, but we are not at a loss for people that we assist. So one of the trends that we're seeing is with opiate use, medical opiate, Vicodin, OxyContin. This has just skyrocketed and is the fastest growing component of addiction in America right now. So it's interesting for me to see what has transpired over the last 4 or 5 years between methamphetamine, and I grew up in Oakland. I've never seen heroin so problematic as I see in Reno right now.
Wow.
Yeah,
well, that's
just absolutely shocking. And the scariest part for me, Tom, is the adolescents that are so ready to climb into the medicine cabinet at home. I read an article the other day that said 12th graders were interviewed, and the only substance used more than Vicodin by 12th graders in America was marijuana, far and away. Roughly a third was marijuana, which is, I consider to be problematic for some people also. Yeah. But Vicodin and opiates are far and away just running rampant in America right now.
Yeah. And so we're looking at the drug, Mick, and then we're looking at how it affects the individual person, but it also affects the family, doesn't it? Can you tell us about that?
Again, this doesn't occur in a vacuum, and keeping the guilt and shame out of it. Nobody gets by unscathed. When I'm the father of 2, I got 2 great kids, and I've been lucky, been real lucky. I'm real proud of them. But I also know, having worked with families and so forth, there's an inclination to say to ourselves, "Did I just see that?" You know, when there's a family, when mom or dad have a substance problem, there's a 4 times greater likelihood that the kids are going to develop a problem and so forth. This is I think one of the biggest problems, Tom, is this whole notion of silence, of let's not talk about it. We always talk about the elephant in the living room, right? Yes. We're family. There shouldn't be anything we're not able to talk about. And I'll tell you, like I said, I've been real lucky, but I dragged my kids around to every presentation I ever did. So they're educated. One of the thing that's cited by adolescents is that they're concerned about how their parents would believe, how they would feel regarding if they found out their kid was using this stuff, is typically the reason they don't use. So this is anything. I'm willing to pull out all the stops. I would like to grab as many people to participate in quality recovery as possible. The less opportunity I have of going underground, the more support I can get, the better off I'm going to do. Yeah,
to reach out and ask for help. Now, earlier, Mick, we were talking about reaching out to treatment, and I was wondering if you would give us your perspective on like how participating in a 12-step group like AA or NA. Can you tell us about that, please?
I am a supporter of 12-step. I will tell you that research suggests, and I support the idea that no treatment approach is universal. It needs to be tailored for the individual. Mm-hmm. I love AA and the AA and NA 12-step support groups, gambling, overeating, everything. Mm-hmm. More in the support that it hands to people who may be giving up a circle of friends, changing their world socially. How often have you and I heard from people who say, gee, when they first get into recovery, gee, I thought I was the only one.
Yeah.
You know, and being able to reach out to people who have been through this and you go, wow, you too?
Yeah.
That is one of the real cornerstones that keep people safe and keep people in recovery.
Yeah, that's an excellent point, Mick, in terms of the identification that occurs and then reaching out and getting help from other people who also understand and are...
We don't like doing this alone.
Yeah,
we
and,
really
they're non-judgmental,
right.
and they know how to recover because they've been there, done that, huh?
Yeah, mostly, yeah. And again, I really appreciate AANA because there's a variance that is allowable. They know that treatment is unique to each person, and they know that some of what they find to be useful won't be useful for everybody, and vice versa.
Yeah, that's an excellent point, Mick, and I'm really glad that we get some more time. We have another segment after this brief break where we continue to get a chance to talk with Mick Hall and tap into his expertise and his wisdom. We'll see you right after this brief break. Hello and welcome back to New Skills for Living as we're talking about recovery from addictive disorders. And so Mick, in the last 20 years there's been more and more focus in treatment on helping those people that have co-occurring or dual disorders, those people that have a problem with alcohol or drugs or other addictions, as well as depression, bipolar disorder, PTSD, and anxiety disorder. Can you tell us about that, Mick? Like, what are those problems and what is the solution? What is the treatment?
I think this is one of the really best developments in treatment in the last 30 years, 50 years. The whole notion of combining, I find it so difficult to separate out mental health issues from substance abuse. They mimic each other, they contribute to each other. We know that mental health, people who suffer from untreated mental health illnesses, have a tendency to have a much greater likelihood of substance abuse. And vice versa, people who have substance abuse problems typically have a much higher rate, likely mental health problem. Mm-hmm. Accurately diagnosing is so difficult because of the similarities exhibited of symptoms between the two. We know that bipolar can exist for 10 years before it's accurately diagnosed because it can mimic symptoms of substance abuse and so forth. Mm-hmm. This is something that we're really passionate about. We have a program unto itself at our agency that supports treatment of co-occurring disorders. Mm-hmm. I think it's absolutely mandatory to be inclusive and understanding of mental health as well as substance abuse. I cannot fathom distinguishing between them anymore.
Yeah, and of course, Mick, have you found that might be one of the biggest reasons why people relapse is that they might get diagnosed as an alcoholic or a drug addict and they're getting treatment for their alcoholism and drug abuse, but their depression, their PTSD, their anxiety goes undiagnosed and untreated. Exactly. And then they return to their alcohol or drug use to more or less self-medicate. Exactly. Can you tell us about that, Mick?
No, self-medication is a huge problem. When people are anguished, when they're stressed, when there's post-traumatic stress disorder, we work a lot with the VA and the vets, and almost every vet that comes back from the war zone is suffering from PTSD at some level. Yes. The unfortunate piece about substance abuse and alcohol is that it works. It works to negate the anxiety sometimes, but it's very temporary, and it contributes to its own set of problems. Anything that we can do to wise people up, that there's no shame in either substance abuse or mental health. I personally like the whole notion of the public health perspective, that this is a health problem at large across America. This is nothing to be ashamed of. And I think the military is starting to finally pick up on this. I think physicians who have one of the highest rates of substance abuse inherent to a career, they're finally starting to get real wise to this, and we're starting to take care of our own and impaired professionals. The whole notion. So often, Tom, distinguishing between these is so difficult, and so treating them at large is the only way to go as far as I'm concerned.
And so, like you were saying earlier, Mick, like one size doesn't fit all. So there might be a combination of individual counseling, family counseling, group therapy, psychoeducation,
Absolutely.
and then also, can you tell us a little bit, maybe sometimes medications to help too, huh?
I think that's the second biggest development that we've seen in the last 15 years. There are medications that are absolutely imperative for some people early in recovery that help control the cravings. The unfortunate piece of the agency that I'm working with right now, we don't have a lot of medical people on staff, so we don't have access to that stuff. But a combination, the most effective treatment force you can have is a combination of the appropriate medication with a physician on board who's willing to reevaluate that on an ongoing basis, and behavioral treatment.
So really treating the whole person, and then earlier you were talking about the whole family. Mick, like in about a half a minute, if someone out there in the audience has been saying, gosh, maybe I do have a problem with alcohol or drugs, and maybe it wouldn't be so bad to reach out and ask for help, what would you say to them right now?
You're not alone. You're welcome. We'd love to do what we can to help you, and if we can't, we'll tell you so. But I can't tell you how much I have learned from people in recovery, what they have taught me about life.
So that idea about you're not alone, and don't be afraid to reach out and ask for help, huh?
Yeah, I can't take the shame that you feel the way, but this is a brain disease. I don't think anybody chose to have this.
Yeah. And then we can hear just a little tiny, oops, I'm getting a message that we don't have more time to talk about families, but of course people can call Al-Anon.
Okay.
You might hopefully now see up on your screen some information, again, to remind you that you can go to that website and see Mick's interview on streaming video. We'll see you next month. Thank you for joining us.